Hello. Today we will be donning and doffing personal protective equipment, PPE, donning, putting on, doffing, taking off. We have to do this in a certain sequence to avoid contamination. So first I'll start with donning, and first we would start with our gown. And you want to cover the whole torso. So we would start by putting arms in. Okay. And then once you get it on, you're going to want to tie it. There's a tie around the waist. There's also a tie around the neck. So we'll turn, and sometimes, very rarely, but sometimes we might be lucky enough to have assistance with this. Other times, not so lucky, which is 9 times out of 10, so we should probably just get used to it now. We're gonna tie the back of our gown behind our neck. I hope that you can see this. All right, so behind the neck, behind the waist will be tied. Our gown is now properly on. Next, we will put on our mask, which the mask is going to be a surgical mask for this task anyways. We have the wire here, so again, you want to wrap this around towards the back of your head. And we're gonna tie. This is donning our mask. Okay, then we'll take this and we're gonna put it behind our neck. Like so. Then you just wanna give it a little pinch. Right there, okay? So now we have donned our gown and our mask. Next, we're gonna don our goggles, or face mask, face shield, whichever you might have. So for this, simply going to put these on. Now, I just like to make sure that this is adjusted and pushed down, because it's very easy for these to get foggy, as you can tell. So if you sit this here, I think it's very important to make sure that they're not foggy, because obviously that can determine how you're working as a nurse, and we need to be able to use our eyes. Last, for donning PPE, the last thing that we're gonna do is put on our gloves. So with the gloves, we wanna make sure that they go over they go over the wrist piece. This is going to keep all contaminated, anything contaminated outside of our body, which would be the purpose of the PPE. I am now successfully ready to do a procedure, depending on what the procedure is, because we have different PPE and precautions, whether it's airborne, droplet, or contact. But so this is donning the PPE. Now, to doff the PPE, we are going to do the exact same sequence, but opposite. There's 2 ways to do it. I prefer the way I've always done it, which is starting with the gloves. So we're going to start here. We're going to want to pull a little bit right here. The outside of these are contaminated. I'm going to pretend I just delivered a baby. And you can't see anything, but it's very dirty. So we're going to take this, pinch it up. If at any point in time our hands get contaminated, we have to wash them immediately. If the gloves rip, immediately we have to wash them. Same thing for any piece of PPE. So we want to avoid getting anything contaminated onto our actual skin. So we're going to pull this, we're going to pull it back, we're going to grab it with this. hold it, because now we have both of them contaminated in one another. Then we're gonna very carefully take our pinky and pull it right over here. Now, contaminated, we're gonna toss. Then the next step we're gonna do is reverse, which would be the goggles. These are also contaminated. So if they're the tie off goggles, you wanna just tie them off, pull them off, and be very, very careful when taking them off. If they're disposable, throw them away. If they can be washed down, then you deal with that after. But they're dirty, so we'll do away with them. Also, I would never do that, but I'm also in my bag.